my audience. Have you ever had to call an ambulance for your family? How would you feel if there was not an ambulance available? Hello, my name is Alex Farlow. I'm a paramedic here at Candler County EMS in Metter, Georgia, and I would like to take a moment to talk to you about a very serious issue: when to call for an ambulance and when not to call for an ambulance. Each year in the state of Georgia, ambulances respond to hundreds of thousands of 911 calls. Sadly, many of these are not emergencies. Most people were taught at a young age, when they're in trouble or they need help, to call 911, but 911 is for emergencies only. Webster's Dictionary defines an emergency as a set of unforeseen circumstances that causes the need for immediate assistance or intervention. Often these circumstances can lead to a person's loss of a limb, loss of life, or a serious injury or illness. An example of some of these serious injuries or illnesses can be when a person is severely injured in a car accident, when they're having trouble breathing, shortness of breath, when they're having chest pain, a possible heart attack, when they're having a stroke, or any time that they have fallen and a bone is sticking out somewhere that it shouldn't be, or anything like that. These are all true emergencies and require an ambulance. An example of types of situations that do not need an ambulance would be anytime somebody just needs to go to the doctor, or they're constipated, or have a headache, a toe pain, a toothache, or if they just want their vital signs checked. Oftentimes people call just because they want their blood pressure checked. However, this is not an emergency and does nothing but tie up an ambulance. If a person wants to have their blood pressure checked or their vital signs checked, there are other means to go about it than calling 911. If a person wants to, they can drive to the nearest fire station or ambulance service, and the crew on scene at the station will be more than happy to check their vital signs for them or check their blood pressure. All of these examples do not require an ambulance and do nothing but tie up the 911 system. Oftentimes when a person feels like they need to be seen in the ER quicker than anybody else, they'll call an ambulance, even though they don't need an ambulance. When the person gets to the hospital, they'll sometimes be placed in the waiting room because the emergency room is busy. The person will then be seen and triaged just as if any other patient, anytime there are multiple patients that have to be cared for. They will then be seen based off of the severity of their illness or injury, and oftentimes have to wait for a room to open up in the ER. Anytime a person calls 911 for a non-emergency, it can be considered abuse of the 911 system. When a person abuses the 911 system, it takes an ambulance out of service and possibly delays that ambulance from responding to somebody else's true emergency. Another ambulance may have to come from further away to respond to this person's real emergency, or it may take that ambulance longer to get there. Another side effect of calling 911 for a non-emergency is the wear and tear that it puts on the vehicle. Anytime an ambulance responds to a call, wear and tear is placed on the vehicle. That wear and tear costs money to repair, to fix, and you as the taxpayers are forced to pay for that wear and tear because many ambulances throughout the state of Georgia rely on some form of tax revenue. An additional side effect of calling for an ambulance is the fatigue and work it places on a first responder. Most of the time those responders are there for 24 hours at the time and are having to respond to your emergency and other people's emergency. If you're calling for something that is not an emergency, you could be interrupting that first responder's sleep or rest period, they may not get to rest again for the rest of the shift. This can cause a responder to become sleep deprived and make poor decisions, poor judgment calls, fall asleep while driving, or any other type of serious injury or serious mistake because they weren't fully rested. An additional danger that somebody calling 911 for a non-emergency is the danger that it places when the ambulance responds with their lights and sirens activated. Most of the time when a person calls 911, the ambulance responds with its lights and sirens activated. Studies have shown that this causes the level of danger to increase exponentially, also to the first responder and the drivers on the road surrounding that ambulance. So before you call 911 in the future, you need to stop and think. Is this really a danger? Is somebody's life in jeopardy? Is somebody's limb in jeopardy? Is somebody seriously ill? Are they seriously injured? After all, how would you feel if an ambulance wasn't there to respond to your family when you needed them the most?